Have you ever experienced unexplained burning pain, tingling, or numbness, especially in your hands or feet? You might have been misdiagnosed or told it's just anxiety, or probably every test comes back normal. But the real culprit could be small fiber neuropathy, SFN. What is SFN? Studio microphone small fiber neuropathy, or SFN, is a disorder that damages the tiny nerve fibers responsible for pain, temperature, and automatic functions like heartbeat and sweating. According to the Cleveland Clinic, SFN affects the distal ends of small unmyelinated nerve fibers, and many cases are idiopathic, meaning no clear cause is found in up to 50% of patients. If you've been struggling with burning pain, tingling, or mysterious numbness, especially in your hands and feet, this video could finally give you answers. Small fiber neuropathy, SFN, is one of the most underdiagnosed causes of chronic pain, and today, I'll break down 1. The hidden symptoms doctors often miss. 2. Shocking triggers you'd never suspect. 3. And the exact tests and treatments that could change your life. This channel is all about uncovering the root causes of unexplained pain, so if that's what you're fighting, hit subscribe right now. Because trust me, you don't want to miss what's coming next. Common symptoms. If you have small fiber neuropathy, you might experience these symptoms, especially in your hands or feet. Fire burning, stabbing, or electric shock pain. Thermometer extreme sensitivity to touch or temperature. Crescent moon pain worse at night. Foot feeling like you're walking on gravel or glass. Beating heart palpitations, GI problems, or dizziness when standing. Fact: a study in Neurology, Oaklander et al., 2013, found that SFN may occur in up to 50% of patients previously diagnosed with fibromyalgia. Why it's hidden? Often missed because standard nerve tests, EMG, don't detect it. Misdiagnosed as fibromyalgia, anxiety, or idiopathic pain. Hidden triggers of small fiber neuropathy, SFN. It's not just diabetes. SFN affects 53 in 100,000 people, but experts say it's underdiagnosed. If you think burning pain and tingling only happen to diabetics, think again. Research reveals 50% of SFN cases are idiopathic, meaning doctors can't always pinpoint the cause. 27. But here's what we do know. 1. Blood sugar chaos, even borderline. Diabetes is the number one culprit, but even prediabetes or impaired glucose tolerance can ignite SFN. One study found 50% of idiopathic SFN patients had undiagnosed glucose issues. 2. Autoimmune attacks. Conditions like Sjogren's, lupus, and celiac trick your immune system into attacking nerves. 20% of SFN cases linked to autoimmune disease. Some patients improve with IVIG therapy. 3. Vitamin deficiencies, the silent saboteurs. B12 deficiency is a major player, especially if you take metformin or PPIs, common drugs that block absorption. Even low normal B12 levels can damage nerves. Copper and folate matter too. Ever had gastric bypass? You're at higher risk. 4. Infections and toxins. Lyme, HIV, and hepatitis C can trigger SFN. Even chemotherapy or alcohol overuse destroys small fibers. Post-COVID SFN is rising. Studies show nerve damage in survivors with lingering burning pain. 5. Genetic mutations, rare but devastating. SCN9A/SCN10A gene mutations cause extreme pain sensitivity, like walking on broken glass. Over 80 sodium channel variants are now linked to SFN. Summarily, who is at risk? Anyone can get SFN, but some people are more at risk than others. Busts in silhouette high-risk groups. People with diabetes or prediabetes. Those with autoimmune diseases like lupus or Sjogren's. People recovering from viral infections like long COVID. Those with fibromyalgia or Ehlers-Danlos syndrome. And in many cases, no known cause at all. Pill treatment options. While SFN can't always be cured, its symptoms can be managed and your quality of life can improve. Toolbox common treatments. Pill medications, gabapentin, pregabalin, duloxetine, and amitriptyline. Fork and knife with plate diet changes, reducing sugar and inflammatory foods. Pill supplements, alpha-lipoic acid, B12, magnesium, consult your doctor. Brain pain psychologists and support groups. Fact: gabapentin and duloxetine have shown up to 50% symptom improvement in SFN patients when taken consistently. How to effectively manage it. Address root causes. O. Blood sugar control, even for non-diabetics. O. Autoimmune therapies, IVIG, steroids if applicable. O. Supplements, B12, alpha-lipoic acid, acetyl-L-carnitine. Symptom relief. O. Medications, gabapentin, low-dose naltrexone, topical capsaicin. O. Lifestyle tips, cooling gels, loose clothing, stress reduction. Hopeful note: some cases improve with treatment. Living with SFN. Living with SFN can feel lonely, but you're not alone. More people are finally getting answers, after years of unexplained suffering. And every story shared helps someone else recognize the signs in themselves. If you've been living with unexplained nerve pain, don't stay silent. Comment below, share your experience, or tag someone who needs to hear this. And if this video helped you understand small fiber neuropathy, give it a thumbs up and subscribe for more health insights that matter.